Most orthopedic surgeons would think that if you want to try and look good, operate on a kid, because they tend to do well, they recover, they have sort of this magical biology, and you know, you can sit around and think that you're a really good doctor, but the fact is that you're starting with someone who's got magical recovery powers, they're really motivated, they don't have any other agenda except to get better. So I sort of have to give credit where it's due to the patient.
He actually thought he was dying, and he said to me, "I'm not ready to die. I don't want to die." And after that, he never cried. He just let me hold him. I remember kids coming out of school and making the decision, well, should we walk home or should we go play on the playground because it's so nice out? So we chose to stay, and that was when the accident occurred. My daughter came over, running over, and yelled, "Ned's bleeding." I didn't know what was wrong. I just knew with this amount of blood, I need to get him inside. As I was holding Ned and running with him, I could feel something slapping my knee. And I remember thinking, his arm is hitting me and it's really low. It feels really low. And so I just grabbed and pulled it up next to him. To hear yourself yell out, "Call 911," because you don't ever imagine you're going to be the person who yells, "Call 911."
We started treating Ned, and that's when we noticed that he had an open fracture. You'll see the bone protruding out, but there's not always a lot of blood. Mom was covered in blood, and kind of puts you on a little high alert. Started ALS care right away and moved Ned into our ambulance.
One of the orthopedic residents called me, and I could hear the tone of his voice was the kind of thing that I knew I was going to have to stop what I'm doing and go to the hospital. He had an injury where the bone was broken and sort of penetrated the skin, so the bone had been sticking out. And he had multiple fractures, so he had broken a bone by the elbow as well as having broken bones in his forearm. So this was really a severe injury. In the course of the 24 hours since his injury, one of the blood vessels in his arm clotted off. So I had to rush him back to the operating room with the help of the vascular surgery staff. And then on Tuesday night, we made the decision to keep him in the hospital, but to admit him to the intensive care unit. As far as the holistic feature is that, you know, especially in children, they're very face value. So I remember with Ned, a couple days into his hospitalization, he wasn't talking too much. And you know, everybody gets traumatized by that experience, but you know, it was my judgment that he just seemed to be a little bit more quiet than usual. So I had this idea 3 or 4 days into Ned's hospitalization that it might be interesting if I bring my dog by and see if that sort of perks him up. You know, it's the idea that you have something engaging that takes a little focus off bad thoughts and all the strangeness.
It was a way to take Ned's focus off of his arm. So even though he knows we're there for his arm, it gives him something else to think about. You
know, everybody likes the dogs. So my dog Chelsea sort of jumped into bed with him and like lay on top of him. And you know, it's sort of like from that point forward, that seemed like a positive thing to do because he looked better.
He thinks it's funny that Chelsea likes to sit on the pillow on the exam table.
You know, I had to do something right away. So I was sort of bring your dog first and ask questions later. So I just basically brought her to the hospital. But you know, it's interesting, in retrospect, after that, the hospital has actually launched a little therapy dog program that's officially present. And I think it was a very positive experience.
To have Dr. Benson really restore so much of Ned's mobility and independence, there's just no way we could ever measurably repay him.